Welcome to the Capital Forum's Antitrust Thought Leaders series. Today I have with me Will Diaz, who's Chief Antitrust Counsel of Amgen. I'm Jeff Bliss. Thank you so much today for joining me, Will.
Thank you for having me.
Yeah, well, obviously we're talking to a very interesting time for Amgen. You guys have been through, well, I guess we'll say, an experience of antitrust recently, right?
It's been a year.
It's been a year. Okay, let's talk a little bit about it. Obviously, the FTC sued to block your proposed acquisition of Horizon Therapeutics. It later settled. We know the details, but being from the inside, maybe you could kind of enlighten us a little bit, summarize kind of what you went through, and I'll just leave it at that. Tell me what you.
Yeah, and it was an interesting deal. Amgen acquired Horizon, which is a rare disease company, and Amgen really hasn't focused on rare diseases, so it was a very complementary acquisition for us, and we were very interested by several of the products that Horizon had, and we reached an agreement with them at the end of 2022, and then spent the better part of 23 through the FTC investigation and ultimately some litigation before we resolved the case, and we're very happy to close it so that we can bring Horizon's products to more people both in the U.S. and outside the U.S. where they had very limited presence. So it was an interesting deal because it didn't involve any horizontal overlaps. There were no vertical issues, so this was really a case of first impression for the FTC. They had been talking about looking at alternative theories, including bundling, and this appeared to be the case where they decided to try that out. I think that the facts weren't particularly helpful for them in this case for that type of theory. What they were alleging is that Amgen would use some must-have legacy products of Amgen in order to further entrench the positions that some Horizon products had. But the reason I say I don't think the facts lined up particularly well is that the Amgen products that they were looking at, like Enbrel, faces a lot of competition. It wasn't a product that had a monopoly position where it could extract something from the payers that the FTC was focused on. And the Horizon products didn't have any competition. So, what was there to extract?
These were orphan drugs for orphan diseases, and so that, by definition, they would not have much competition.
Right. And so the FTC's theory depended on a lot of things that had to occur in the future for there to ever be a problem. And so that's why we felt very confident going into the litigation that we'd be able to prevail. But ultimately, we were able to resolve it in a way that I think was beneficial, obviously, for both parties, and that's how we reached the agreement. We had told them from the beginning we never planned to bundle these products. There weren't any documents discussing that. There was never part of our strategy. And there were a lot of regulatory hurdles to be able to even engage in the type of bundling behavior that the FTC was worried about. So we committed from very early on that we wouldn't do it, and we were happy to enter into a consent order if that's what they wanted. And ultimately, they agreed that was what would resolve this. And very happy to be able to close it at the end of the year and start integrating the company.
Yeah, I wanted to ask you about, why did they? I think one thing, like a lot of our readers are like, when it happened, some of them were surprised, some were not, but were surprised, and they were like, well, how are they applying this bundling theory? And if correct me if I'm wrong, it was basically bundling with Enbrel, I think, right, with these two orphan drugs to make sure that when other drugs that would come on to challenge their monopolies, essentially, which orphan drugs, that like PBMs or other, they would be on these formularies altogether, and it would stave off that competition. That's the general theory, right?
Right. That's the theory. So. All of the drugs that the patients in America use are on a formulary. Okay,
Right.
and insurance companies design their benefit design so that you know which products you can take and for what
and that they'll pay for. That this is like the list, this gilded list of insured drugs.
Exactly,
Right.
And there is significant competition to be on the formulary. Okay, all of these products that you see, all these drugs are in competition to have the best position on the formulary, because ultimately what you want is access. You want patients to have access to all of the medications that you can. And so what the FTC was alleging is that we would use a product like Enbrel to make it difficult for would-be entrants that would compete against the Horizon products, Tepezza and Krystexxa specifically, and to try to exclude them from the formulary. Okay. The reality is that the Enbrel and Tepezza and Krystexxa are in totally different benefit designs. So Enbrel is a self-administered product. It goes in the pharmacy benefit. You're able to get it from your pharmacy, whereas Tepezza and Krystexxa are medical benefit products, which means that a doctor administers it to you. So when you're negotiating agreements for the formulary position, they're with different entities, they're with different people. There really has never been any bundling across those two from anybody, from those two benefit designs. So it really wasn't something that we thought could happen. And more broadly,
well, I wanted to ask you about that because one thing, first, I know that they addressed that and they were saying that they didn't obviously buy that argument, but that was something that obviously that was worked out in the settlement. But I wanted to ask, like in terms of like, why would they go after this particular deal? And one thing the line that kind of stood out to me in the complaint is they referred to this case, this private lawsuit, Regeneron, and they made a point. This private suit, which as you well know, has alleged this bundling behavior in an anti-competitive way, has survived a motion to dismiss. And I'm just wondering, from your point of view, was that the thing? Like that gave them in our view, they did it once, they might do it again. Do you think that might? I'm talking about in their mindset. Sure. Do you think that's what it was?
I don't know. I don't know if that's what did it. Obviously, that's an ongoing lawsuit. The FTC has no involvement in that case, and surviving a motion to dismiss just means that the complaint was pled in a way that that withstood a motion on procedural grounds. It really doesn't have anything to do with the facts. And the FTC never alleged that anything we did in that bundle was anti-competitive. Okay, in that case, they just merely said there's this ongoing case,
they did
and so Amgen has bundled in the past. And I think that goes to the broader point that I was mentioning, that bundling is pervasive in our society. I mean, I have insurance with home and auto. I just took a trip through Costco Travel that bundled flights and the hotel and car rental. If you look at the Super Bowl, I can't tell you how many bundling ads I saw for Geico or other things. So there's nothing inherently anti-competitive about bundling. It brings great benefits to consumers at lower prices.
Yeah, and let's take a little pause here because that's an important point. And I've actually, my understanding is that the FTC and DOJ and even in this administration, which has been more aggressive about going after what they see as anti-competitive bundling, there's always there is, in some ways you could say pro-competitive bundling, or certainly neutral to competition bundling.
Yeah, absolutely. I think in general it is pro-competitive. Of course, there can be instances where it's anti-competitive, and
Khan, I was going to say, pointed that out. FTC Chair Lena Khan. There was this 2-day workshop, as you probably have memorized the transcript of it, back in 2022, where they kind of telegraphed the things that they're looking at, and one of them was anti-competitive bundling. And farmers,
yeah, and so the reason I point out that bundling can be very pro-competitive is that the FTC obviously has an anti-competitive practices shop that looks at behaviors that are occurring in the market and can analyze whether there is bundling activity that's pro-competitive or anti-competitive. And so one of the points we made in this deal is that you don't have to block a deal because of potential anti-competitive conduct. You can look and see, is that conduct occurring? And you still have a part of your agency that can review that conduct specifically and determine if it has. And that's in contrast to what the FTC normally looks at in acquisitions, which is if, for instance, there's a horizontal overlap, is that going to lead to higher prices, right? Well, once the merger is done, there's really not much you can do about higher prices because that's just being done by a party unilaterally. There's nothing wrong with that under the antitrust law. So you do have to think about it at the front end before the deal happens about whether you're going to challenge the deal because it may lead to anti-competitive pricing. But when it comes to bundling, you really don't. You could wait and see, does it even occur? Does it even make sense? You still have the ability to do that, and you don't need to block a deal that otherwise appear pretty clean.
That's interesting, but I get what you're saying, but wouldn't it also be fair to say that one reason they had the Clayton Act is because they wanted to go after mergers, give the government a power to go after mergers to kind of nip in the bud, get it nascent, not only the higher prices, but just conduct that might be bad. So again, I'm not. I hear what you're saying is like there is another mechanism here. Is essentially what you're saying.
Yeah,
If they want to do,
the Clayton Act obviously has an incipiency standard. It is meant to be forward-looking, absolutely. But we have, well-established body of law and economics about what are the types of things that are likely to happen, and you do have to establish some likelihood. Here, it really was speculative in our mind, both because of the regulatory barriers that we're talking about, and just that there was, absolutely nothing in the record that would signal that we plan to do any of the bundling that was discussed.
all right. Well, this sets up like a question that a lot of our readers had is like, okay, we know though that the FTC in this administration still is very concerned about this behavior in general. So, is there anything like you can kind of that might be like in your mind an indication of like, rightly or wrongly, however you personally feel about it, but how this FTC will look at a situation and say, this situation's fine. And this situation, I'm a little worried about. Is there anything like?
Yeah, I think there is, some of that, and obviously they've since published the merger guidelines.
Yes.
There are some guidelines that I think relate to the conduct that was alleged here, in particular the ones that talk about the ability and incentive framework and the entrenchment theories. So there is something out there. I think there can be more. Okay, and I would urge the FTC and the DOJ to engage with the business community and talk about what are the things that they are looking for and with more concreteness, because what a lot of people felt, I think, when they challenged our deal is, well, where's the line? That acquisition didn't have any horizontal issues. It didn't have any vertical issues. If we're talking about bundling, well, any merger could potentially involve bundling as long as there's products on both sides of the deal. So what was it about this that was a concern? And the FTC may point to the prior bundling the case that they're talking about. But it felt like there could be more to try to understand that, because as practitioners, when we're trying to advise our clients, we're trying to assess, is this going to raise a concern at the FTC? And we listen to what the FTC is saying about their concerns and try to ensure that our deals either don't raise those concerns or that we're ready to answer those questions. And so I think there could be more done in the space to understand that, because I think other than the traditional theories that we've had for many years of horizontal and vertical, these new theories are more difficult to quantify and to understand what's going to raise concerns.
As you were saying this, you also reminded me of something else about, like, let's look back in your case. Embro has indications for certain things, but it's not really related in the market. And tell me if I'm wrong. I don't think there are any indications where it was doing anything that the orphan drugs.
No, there's no relation at all. And it's a very competitive marketplace that Enbrel faces, both branded competitors, numerous branded competitors, also biosimilars that are in the market. So while it's a great product that's been around for many years, it faces significant competition. And so that's why, again, I said that I thought it was typically when you have a bundling or tying case, there's one product that's very dominant that you're leveraging to try to help some other product. But here's kind of the reverse in a sense, because you had Enbrel that faces a lot of competition, and the Horizon products at the moment were facing none. And so it was kind of an interesting theory, and that's why we felt like they had some problems from the facts.
Well, I was also I could ask you, but in the horizontal, the new merger guidelines, not horizontal, they're all together. They also mentioned something about if the bundling involves products in adjacent markets, I think is the term, or it's essentially what they mean. Is that also in your mind? Also, like if you have like if that's the thing they're talking about, like, oh, that might be something that more might run afoul of this particular FTC?
It could. I mean, I think that as I think about, we're going to continue to have cases with traditional theories, obviously, and then I think about, well, what other areas should we expect there to be some scrutiny on? I think that if you look at their entrenchment, their guidelines that deal with entrenchment, I think that they will be particularly interested in deals where one of the parties does have a product that has a very strong market position, even if it's not in the same space as the other product. If there's an ability to leverage that market power, I think that's something that they will be interested in. And I think that if a deal is particularly large, involves two significant companies, even if they don't compete head to head, I think that we can expect some additional scrutiny, either because of theories like the entrenchment theory or maybe because of a concern of loss of innovation in a certain area. And so I think we'll continue to see some scrutiny in those areas. But again, I would say what would be helpful is to have more understanding of what are the types of issues that will raise concerns. And in my industry in particular, the length of time for the review. Because for us, a lot of times when we're doing these acquisitions, it's because we think we can get drugs to market quicker, more effectively in the hands of doctors and patients. And having long delays before you can close your deal really put some headwinds into our ability to do that.
That's interesting. Because I had never thought about like that being part of the process. Because increasingly, obviously, and this kind of goes in another area I want to talk to. It's these pipeline drugs that they're focusing on, and well, they've been doing that for a while, but I think increasingly with this administration, they're looking at. Now they're obviously going through an FDA clinical trials. Can the antitrust regulatory process at all slow down those regulatory? How does that?
No, I wouldn't say they
Okay.
slow down the FDA regulatory process, but our ecosystem in biopharma involves significant research and development from the largest companies that everyone knows about, but also from some of the smallest companies, especially in biologics. It's really difficult to find new molecules that can help people, and they can come from all over. And when you have them coming from smaller companies, this is why M&A is so important, because they're not built a lot of times to become a big company necessarily, right? They're looking to bring a therapeutic to market as quickly as they can, and they often lack the resources to do that. That can be resources from a regulatory perspective. It can be commercial, resources. And so when they can do an acquisition with a larger company that has those resources, we can help them through both our experience, but also just the manpower, to be able to get things done more quickly through the FDA process, conduct clinical studies more quickly, and use the relationships that we have to be able to push those products as quickly and as safely as possible into the hands of doctors and patients. And so, obviously, when you have a deal that's in its pendency, you can't take those steps because of gun jumping concerns. Obviously, you can't start to do that. You have to wait for the deal to close.
So the company, that's the smaller company in this case, has to continue doing it on their own.
Exactly.
Okay. I wanted to talk to you a little bit. Obviously, the chair, Khan, has made some comments about it. She's very focused on the pharmaceutical industry. Obviously, with high drug prices, she's talked about it a lot. One thing she says is a concern, and you talked about innovation before, is that sure, drug makers buy smaller, and she says, I understand this process, but it seems like that seems to be more and more what the large pharmaceutical makers, they're basically buying the innovation from these smaller companies, but a lot of the innovation is inordinately is coming from these smaller companies, and the larger companies are just doing it. And it's like what she would obviously like to see is the large companies, as they have done in a very storied past, come up with the drugs themselves, compete against some of these companies, and then other cases that kind of more of a where there's more of a mix where the larger companies coming up with things on their own. So tell me about, like, is her perception wrong in your view, or does she have a point?
Yeah, I think there is a mix. Okay, I mean, even Amgen started in 1980. Right, it's not that long ago, and developed into being a large pharmaceutical company. And I think you still will see stories of companies that develop from small to medium to large. That's going to happen. But I think that we would be hurting our ecosystem if we didn't allow, or if we made it more difficult for some of these innovative smaller companies to have an exit strategy. Because the reason they're getting investment from the investment community is because they think that there is going to be a point in time in which there's going to be either a license or an acquisition or something, okay, that helps fund that project to completion and ultimately gets those products out in the marketplace. And I don't think we can expect all of those companies to make it, to become a large pharmaceutical
Not the
company
next Amgen, is what you say.
at the end of the day. There are going to be several of those, but we also have to reward the smaller, innovative ones that aren't looking to be that, but are just looking to get their products to market as soon as they can.
All right. So you think she it's not the worst thing what she's saying is like, yeah, there should be a mix, and yeah, we can do that, but like not to understand that it can't be all one way too, and like
Yeah, and look, I think that if there aren't competitive overlaps, if there aren't the type of horizontal concerns that you have, then you really have a situation where a company like Amgen or somebody else is attracted by the success or the potential success of that product and is willing to put significant resources and take on the risk of that product to bring it to market. And you're not going to have the price effects that you would have if they were a competing product, right? And so, to me, I think that there's it's a win-win situation, for the marketplace and for patients ultimately.
let's talk a little bit about the pipeline process, about pipeline products. I mean, it's becoming increasingly a focus of the FTC. Uh, we obviously these are products that may never come to market, but they have. I mean, it's for years where they're like, well, no, we have to do some divestitures. In the past, that's kind of how they dealt with it. Are you finding with this FTC that they might be looking at pipeline products even more aggressively in terms like we're afraid that like if this merger goes through for whatever reason, this is not going to get to the patients. I mean, that would be obviously a reason. Are you seeing that more from this FTC or not?
Yeah, well, there has been an evolution, I'd say, that started even before the current administration at the FTC. If you went back 20 plus years ago, I think that there wasn't as much scrutiny on acquisitions that involved early pipeline assets. So if you had, a drug that was in phase 1 of the clinical trials, which, has a less than 50% chance of success, it's going to take many years. I think the FTC took the position that it would be hard for us to challenge an acquisition of that because it's so nascent. It's the likelihood is so low that it's going to come to market that it's not worth resources to really challenge those types of deals. And I've seen that shift happen, over the past several years, where there is more of a concern, even in early stage assets, if there is competitive overlap. If you've got a company that has a product in the market, let's say, and they're acquiring a competitive product, but that is in early stages. That is something that the FTC is going to care about, and we've seen them challenge deals recently that had those facts. On the other hand, I am heartened by the fact that I have seen several deals over the past year that involve early stage assets without overlaps, and that were cleared in a relatively short period of time, and that's great because if there aren't those concerns. I mean, I'm happy to see the FTC devoting the resources to the cases that that they do plan to challenge or to take a significant investigation and clearing those other ones quickly because, as I said earlier, that's really important, especially with early stage assets, to be able to move those through the pipeline as quickly as possible, and getting them in the hands of the new company and integrated is critical.
So yeah, you're essentially saying they're being discriminating. They're not going after everything. And would you say that this is like you're seeing that develop within this administration over a timeline? You're seeing even within the time that Biden has been in, that the FTC is kind of narrowing its focus, like these are the deals that we're concerned about. These other deals we're fine with.
Right. It feels that way. Obviously, It's hard to tell,
right.
I
understand. Anecdotally,
since I only have one client as an in-house counsel. But, it does feel like, last year there was a few big pharma cases that they had, that they devoted significant attention to. But towards the end of the year, we started to see some other ones that went through without much of a concern. Again, those did involve, early stage assets, not so much products that were on the market for both sides. But that's important because I'd say that most of our acquisitions involve those types of deals where it's an early stage company. It's more rare the case that that you're acquiring a company that has a variety of products that are already in the market.
All right, so it sounds like fitfully perhaps we're getting to some type of checklist perhaps, or we can use in our analysis or screening that give us an idea of what the FTC might care about and what they might not. Is that fair to say that we're kind of going towards that a little bit?
I think so. I mean, I think so, especially as I said in those early stage deals. I think we are seeing that, and hopefully that'll continue. It'll be interesting to see when there's the next big biopharma deal that involves bigger companies that have products in the market. And how the FTC views that. Are they going to apply traditional horizontal and vertical analyses, which I'm sure they will, But then what else? You know, what if those issues aren't there? What are they going to be interested in? Is there some entrenchment theory or something else? And so trying to understand at the front end as much as we can about that helps us because you know, look, the last thing you want in a deal is to have a prolonged investigation, or even worse, to have a challenge. Right? You're trying to get a deal done. That's the goal. And so if we can understand that, you know, what are the issues early on, then we can be better about the deals that we bring, for review at the FTC.
Fair enough. Well, thank you so much. This has been very helpful just to kind of go through and all the different changes in your industry. Well, thanks so much for joining me.
Thank you.